One of the most challenging aspects of liver cancer is that it's often called a silent disease. Most people don't experience any symptoms until the cancer has already grown significantly or spread. But here's something critical that many people don't realize. In some cases, the body does send out warning signals before serious liver damage occurs. These signals are just incredibly subtle and easy to dismiss. Understanding these early signs could be life-saving. When liver cancer is caught in its very early stages, before the tumor has grown large or the liver has sustained significant damage, survival rates can exceed 90%. But once the disease progresses to advanced stages, that rate drops dramatically to less than 20%. The difference between catching liver cancer early and discovering it late isn't just about adding a few extra months to life. It can literally be the difference between a highly treatable condition and a terminal diagnosis. So let's talk about the 5 liver cancer signs that can appear before serious damage occurs. This information is presented in a comprehensive, educational way, focusing on what people need to know to recognize these warning signs and seek medical attention before the disease progresses. Sign number 1, unexplained episodes of low blood sugar. The first early sign that can appear before serious liver damage is unexplained episodes of low blood sugar, medically called hypoglycemia. This is one of several paraneoplastic syndromes associated with liver cancer, conditions where cancer causes symptoms in parts of the body distant from the tumor itself. Now, hypoglycemia is more commonly associated with advanced liver cancer, but research has documented cases where it appears as an early, atypical presentation of the disease. Medical literature specifically describes hypoglycemia as an early warning sign that should prompt investigation for liver cancer, particularly when it occurs without an obvious cause. What does hypoglycemia feel like? People experiencing low blood sugar might feel suddenly weak, shaky, or dizzy. They might develop an irregular or rapid heartbeat. Some people experience numbness or tingling around their lips or in their face. In more severe cases, they might feel faint or actually lose consciousness. These symptoms typically improve quickly after eating something, particularly foods containing sugar. The mechanism behind cancer-related hypoglycemia is complex. Some liver tumors produce substances that mimic insulin or that interfere with the body's glucose regulation. Other tumors consume enormous amounts of glucose as they grow rapidly, depleting the body's blood sugar levels. In some cases, the cancer affects the liver's ability to release stored glucose into the bloodstream, which is one of the organ's normal functions. What makes this symptom particularly significant is when these episodes occur in someone who doesn't have diabetes and isn't taking medications that would explain low blood sugar. If someone starts experiencing recurrent episodes of feeling shaky, weak, or lightheaded, especially between meals or upon waking, and these symptoms improve with eating, this warrants medical evaluation. Blood tests can measure glucose levels and help determine whether hypoglycemia is truly occurring and what might be causing it. Sign number 2, persistently elevated cholesterol levels. The second early sign is persistently elevated cholesterol levels, specifically high total cholesterol that appears without the usual dietary or lifestyle explanations. This is another paraneoplastic syndrome associated with liver cancer, and research indicates it tends to develop earlier in the disease course than some other paraneoplastic symptoms. The liver plays a central role in cholesterol metabolism. It produces cholesterol, processes dietary cholesterol, and helps eliminate excess cholesterol from the body. When liver cancer develops, tumor cells can begin producing cholesterol autonomously, independent of the body's normal regulatory mechanisms. Studies have found that more than 90% of the cholesterol produced by liver tumors is released directly into the bloodstream. What's particularly interesting about paraneoplastic hypercholesterolemia in liver cancer is that it represents abnormal cholesterol production rather than the typical causes of high cholesterol like diet, obesity, or genetic factors. Research has documented that this form of elevated cholesterol is present in approximately 20 to 25% of liver cancer patients, making it one of the more common paraneoplastic syndromes. The challenge is that elevated cholesterol by itself doesn't cause obvious symptoms. Most people only discover they have high cholesterol through routine blood testing. But here's what's significant. if someone has their cholesterol checked and it's suddenly elevated when it was previously normal, or if cholesterol levels rise despite lifestyle changes or medication, this could be an early warning sign. This is especially true for people who have risk factors for liver disease, such as chronic hepatitis infection, history of heavy alcohol use, or fatty liver disease. It's important to note that doctors would need to rule out other causes of high cholesterol before attributing it to liver cancer. But in someone with liver disease risk factors, unexplained hypercholesterolemia should prompt further liver evaluation, including imaging studies and tumor marker blood tests. Sign number 3, elevated red blood cell count. The third early sign is an elevated red blood cell count, a condition called erythrocytosis or polycythemia. This paraneoplastic syndrome occurs in approximately 3 to 4% of liver cancer cases, and significantly, it tends to develop earlier in the disease course than some other paraneoplastic symptoms like hypoglycemia or hypercalcemia. Erythrocytosis happens when liver tumor cells produce and secrete erythropoietin, a hormone that stimulates red blood cell production. Normally, the kidneys produce erythropoietin in response to low oxygen levels, signaling the bone marrow to make more red blood cells. But some liver tumors begin producing this hormone inappropriately, causing red blood cell counts to rise even though the body doesn't need more oxygen carrying capacity. Research indicates that erythrocytosis is one of the better studied paraneoplastic phenomena in liver cancer. And interestingly, patients who have this condition actually tend to have slightly longer survival times compared to those with other paraneoplastic syndromes. This might be because erythrocytosis is more likely to be detected through routine blood work before the cancer becomes extremely advanced. What symptoms might someone with erythrocytosis experience? The condition can cause persistent headaches, a feeling of fullness or pressure in the head, dizziness or lightheadedness, blurred or distorted vision, ringing in the ears, and a ruddy or flushed complexion. The person might look red-faced or flushed even when they're not hot or exercising. Some people also experience itching, particularly after a hot bath or shower. Like elevated cholesterol, erythrocytosis is typically discovered through blood testing rather than through obvious symptoms. A complete blood count showing elevated hemoglobin or hematocrit levels, the markers for red blood cell count, should prompt investigation, especially in someone with liver disease risk factors. Doctors would need to rule out other causes of elevated red blood cells such as chronic lung disease, heart problems, or living at high altitude. But in the right clinical context, this finding should trigger liver cancer screening. Sign number 4, unexplained elevation in blood calcium. The fourth sign is elevated calcium levels in the blood, a condition called hypercalcemia. While this paraneoplastic syndrome more commonly appears in advanced liver cancer, medical case reports document instances where hypercalcemia was the initial presenting symptom that led to liver cancer diagnosis. Hypercalcemia in liver cancer occurs through several mechanisms. Some tumors produce a substance called parathyroid hormone-related peptide, which mimics the action of parathyroid hormone and causes calcium to be released from bones into the bloodstream. Other tumors produce substances that directly affect calcium metabolism. Research indicates that paraneoplastic hypercalcemia occurs in approximately 5 to 8% of liver cancer cases. The symptoms of hypercalcemia can be quite varied and often don't immediately suggest a calcium problem. People might experience extreme thirst and frequent urination as the kidneys work to eliminate excess calcium. They might develop constipation, nausea, and vomiting. Muscle weakness is common, making it difficult to perform normal activities. Some people experience confusion, difficulty concentrating, or memory problems. Headaches and fatigue are also frequent symptoms. There's an old medical saying about hypercalcemia symptoms: stones, bones, groans, and psychiatric overtones. This refers to kidney stones, bone pain, gastrointestinal complaints, and mental status changes, all potential manifestations of elevated blood calcium. What makes hypercalcemia particularly significant is that it's associated with more aggressive disease and poorer outcomes. Studies have found that when hypercalcemia appears as a paraneoplastic syndrome in liver cancer, it often indicates a larger tumor burden and more advanced disease. The median survival after hypercalcemia develops has been documented as quite short in some studies, as brief as 15 days in one report, though other research shows somewhat longer survival times. This underscores why recognizing hypercalcemia early is so important. If blood tests reveal elevated calcium levels and other common causes like parathyroid problems or bone metastases are ruled out, liver cancer should be considered as a possible cause, particularly in someone with chronic liver disease. Sign number 5, worsening of pre-existing liver disease symptoms. The fifth sign is somewhat different from the paraneoplastic syndromes discussed above. It's the subtle but progressive worsening of symptoms in someone who already has chronic liver disease. This is particularly relevant because most liver cancers, approximately 80 to 90%, develop in people who already have cirrhosis or chronic liver disease. Someone with hepatitis or early cirrhosis might have learned to live with certain symptoms, perhaps mild fatigue, occasional abdominal discomfort, or minor digestive issues. These symptoms might be relatively stable for months or even years. But when liver cancer begins to develop, there's often a change in the pattern or severity of these baseline symptoms. The fatigue might become more pronounced, no longer improving with rest. Abdominal discomfort that was occasional might become more frequent or more bothersome. Appetite might decrease more noticeably. The person might start losing weight without trying, even if they're eating normally. There might be increased nausea or a feeling of fullness after eating small amounts. What's crucial about this sign is that it's easy to dismiss. Someone with chronic liver disease might assume their condition is simply progressing naturally. Their doctor might attribute worsening symptoms to advancing cirrhosis. But research indicates that this pattern of symptom worsening can be an early indicator that cancer has developed. Medical studies specifically note that people with chronic hepatitis or cirrhosis who develop liver cancer might first present with a worsening of their pre-existing symptoms or changes in their laboratory test results, particularly liver function tests or alpha-fetoprotein levels. Alpha-fetoprotein is a protein that's often elevated when liver cancer is present, and monitoring this marker in high-risk patients can help detect cancer early. This is why regular surveillance is so important for people with chronic liver disease. Current medical guidelines recommend that individuals with cirrhosis or chronic hepatitis B should undergo screening for liver cancer every 6 months, typically with ultrasound imaging and blood tests for alpha-fetoprotein. This surveillance is specifically designed to catch liver cancer at its earliest stages, before significant symptoms develop and before the tumor has grown large. Understanding who's at highest risk for liver cancer is crucial because these are the individuals who should be most alert to these early warning signs and who should be receiving regular screening. The highest risk group includes people with chronic hepatitis B infection, which can cause liver cancer even in the absence of cirrhosis. People with chronic hepatitis C infection, particularly if they've developed cirrhosis, are also at significantly elevated risk. Individuals with cirrhosis from any cause, whether from alcohol use, fatty liver disease, autoimmune conditions, or other liver diseases, have increased liver cancer risk that rises with the severity of cirrhosis. Other important risk factors include non-alcoholic fatty liver disease, particularly when it has progressed to non-alcoholic steatohepatitis with fibrosis or cirrhosis. Heavy alcohol consumption over many years increases risk. Certain inherited conditions like hemochromatosis, which causes iron buildup in the liver, also elevate risk. People in these high-risk categories should be working closely with a hepatologist or gastroenterologist who can provide appropriate surveillance and monitor for early signs of cancer development. Liver cancer often develops silently, but it's not always completely without warning signs. 5 signs that can appear before serious liver damage include unexplained episodes of low blood sugar, persistently elevated cholesterol levels, elevated red blood cell count, unexplained elevation in blood calcium, and worsening of pre-existing liver disease symptoms. These signs are subtle and easily dismissed or attributed to other causes. They're also relatively uncommon. Most people with liver cancer won't experience the paraneoplastic syndromes. But for the individuals who do develop these early warning signs, recognizing them and seeking prompt medical evaluation could lead to diagnosis at a stage when the cancer is still highly treatable. The key message is this: people with risk factors for liver disease should be aware of these potential warning signs, should be receiving regular screening as recommended by their doctors, and should take any new or worsening symptoms seriously. Early detection of liver cancer saves lives, and understanding these subtle early signs is one important piece of the early detection puzzle.